Have you ever imagined what the doctors look at when they're looking at the X-ray? How can they read? In this lesson, we will focus on the radiology of thorax. We will look at some of the X-rays and we will find out how we can read different lines and structures presented on the X-ray and how can we diagnose diseases using those lines and structures. So let's begin with this X-ray of a thorax. When doctors examine a chest X-ray taken from the back, or back is also known as your posterior anterior view, they pay close attention to certain areas where the lungs meet other structures like your diaphragm, heart, and the areas in the middle of the chest, which is called your mediastinum. So here, let me highlight for you if you can see. Okay, here. So this structure here is your heart. Right, these are the main veins coming up of your heart. Then this is your lungs, apex of lungs. Then there are different lobes. This is the other side of the lungs. This is the apex, and they are here. This side here have other lobe, right? And this here, the structure between the two lungs is your mediastinum, where we said in the previous lecture that there are in the mediastinum, in the middle mediastinum, your heart is located in the middle mediastinum. So these are the lines and structures doctor look at when reading an X-ray. Now, imagine these areas. These areas are like borders where the lungs will meets the other part of the body, and in these borders, doctors look for the certain things that can help them identify if something is wrong. One thing they look for is called a line or a stripe. So here you can see that right paratracheal stripe. Let me erase it for you. Oops. Okay, see, this is a stripe. This is your right paratracheal stripe. So they look for these lines or stripe. This is like a thin mark or shadow that they see on the X-ray. For example, there is a line near the trachea or windpipe on the right side. Again, we looked at it right now. Right paratracheal line, tracheal stripe is the line which is near the trachea, your windpipe on the right side. Okay, then they also look for silhouette. Let me erase these red parts for you, so it's easier for you to understand and we move forward from here. Okay, here you can see again para-aortic line, paraspinal line. Uh, right. So we said that doctors look for the stripes and they look for the lines on the X-ray. So here your paraspinal line, there is your para-aortic line, there is your right paratracheal stripe. Other than these, they also look for silhouettes. These are the shapes that they can see, like normal shape of the aorta or the left ventricle of heart. So here you can see this is the shape of the heart, which is quite clearly visible. So here you can see this is the shape of the heart. Heart is located in the middle mediastinum between two lungs. You can see the lungs. You can see these are the lines of the ribs. Sorry for this. Okay, here. So these are the lines of ribs. Right, this structure in the black is your lung. This is your trachea. Okay, these are the silhouettes signs. So now, why are these lines and shape important? They can help doctor find problems, because if something is wrong, these lines and shapes might not look normal anymore. This is called your silhouette sign. So these are the silhouette sign. If there is edema in the lungs, so you might not see this line, this part of the heart Celotus sign here, celotus line here. So this won't be visible anymore if there is water in the lungs, if there is edema in the lungs. Then there is one specific thing that doctors watch out for, that is your esophageal line or recess. It's like a little space or line near where the azygous vein, a blood vessel, and esophagus, the tube that carries your foods to the stomach, are. And this space can sometimes change if there is something going on in the chest, like an abnormal growth or swelling. So this is the part where you can see. It's highlighted in orange. This is the part where doctors look for the azygous esophageal recess. So if there is a problem like your abnormal growth or swelling or something is wrong in the chest, this part will clearly indicate. Doctors use these lines and shape on the chest x-ray to spot any changes that might signal a problem in the lungs or the areas of the chest. Now we talk about the azygous esophageal recess. Let's look at this azygous esophageal recess in detail. So here's another X-ray which clearly indicates the azygous esophageal recess. So this recess is the region which is inferior to the level of the azygous vein arc, and in which the right lungs will form an interface with mediastinum between your heart anteriorly and vertebral column posteriorly, and it is bordered on the left side by the esophagus. Now imagine a space between the chest, right, where the right lungs will meet the mediastinum, which is the area between the lungs. Your mediastinum is the area between the lungs. This space is called your azygous esophageal recess, and it is found just below where the azygous vein arc is located. In this area, your right lung will touch the mediastinum, which is the space between the heart in front and the vertebral column in the back. And on the left side of this space, there is your esophagus and the tube that carries the food to your stomach. Then this diagram clearly indicate all of those structures. Then now sometimes doctor also look at a chest x-ray and notice that the lines where the azygous esophageal space meets the lungs and other structure, it is not in its usual place. So this happens due to the 4 to 5 reasons, which are very common. So number one reason is your hiatal hernia. You can see here in the yellow arrow, this indicates a hiatal hernia. Hiatal hernia, this is when a part of the stomach pushes through the diaphragm into the chest cavity, and which can affect the position of nearby structures like your esophagus. Then you might get esophageal disease. This condition affecting the esophagus, like your inflammation or tumor, can cause changes in nearby structures and their position. So your azygous esophageal recess, it will indicate that there is a problem. The structures are not in its usual place if there is an esophageal disease. Then another reason why is your left atrial enlargement. When the left atrium of the heart becomes enlarged, it can push against nearby structures, which will include your esophagus, which might alter the azygous esophageal line. Then we have subcardial lymphadenopathy. So subcardial lymphadenopathy, we said, is the fourth reason there will be a unusual change in azygoesophageal recess. So what is subcardial lymphadenopathy? There will be an enlarged lymph nodes in the area between lungs, so which means that subcardial region is the area between lungs, and there will be an enlarged nodes that can push on the surrounding structures, which will lead to a deviation in the azygous esophageal line. Then another reason is bronchogenic cyst. A fluid-filled sac in the lungs can also affect nearby structures, potentially causing changes in azygous esophageal line. So when the doctors see changes in the position of azygoesophageal line on a chest X-ray, they might consider these conditions as possible cause and investigate further to understand what's going on in the chest. So this is the overview of azygoesophageal recess. 5 reasons why they will, which will indicate that there is a problem in the chest, in the recess area, which doctors look at, is your hiatal hernia, esophageal disease, left arterial enlargement, subcarinal lymphoadenopathy, bronchogenic cyst. So these are the 5 reasons. Now let's look at these two images at the bottom. So I hope you can see my cursor. Okay, this one and this one. In this one, we will look at the azygoesophageal line, which usually looks a certain way on the X-ray, right? But in this part, you can see there's something clearly wrong. You can see this white part squishing out of some organ here, and you can see this line is not supposed to be like this, right? This is the azygoesophageal recess. In these two bottom images, right, it's azygoesophageal line is not where it's supposed to be, and doctor will think that it's because of the something called your hiatal hernia. That's when part of your stomach moves up into your chest through a hole in the diaphragm. So here you can see there's a hole, and the part of the stomach is moving up in the chest. The muscle that separates your chest from your abdomen is your diaphragm. To confirm this, they are pointing at something on the X-ray called your barium contrast. Now what will happen? We notice that azygoesophageal line is not where it's supposed to be, and then we're going to put something called your um, co- uh, barium compound, barium contrast compound. We will put it in the stomach, and then we will have an X-ray, which will clearly indicate that there is something wrong. And we can see that in the X-ray, we can see the area where they think the hiatal hernia is. So in this case, you can see this part. This part indicates that there is a hiatal hernia here. Let's look at the top image here. Let's zoom in. Okay, yeah. So the top part, vena azygous lobe. A common normal variant is the azygous lobe, and the azygous lobe is created when a laterally displaced azygous vein makes a deep fissure in the upper right part of the lungs, as indicated in the diagram. So this is your azygous vein, and it is cutting through the upper part of the lung, and it is creating a deep fissure in the upper part of the lungs. So what does it mean? And we can say that on a chest film or the chest X-ray, right, it is seen as a fine line that crosses the apex of the right lung. So what does this mean? In the simple terms, we say that sometimes on the chest X-ray, doctor sees something called your azygous lobe, and it is not a problem. It's just a normal variation that some people have. And here's what happens. Normally, the azygous vein, a blood vessel in your chest, runs up the right side of your spine, but sometimes it's a bit off to the side, and when it moves, it can make a little split in the upper part of your lung. So here you can see there's a little bit of a split in the upper part of the lung, and when the doctor looks at the X-ray, they see this split as a thin line that crosses the top of the right lung, and there's nothing to worry about. It's just how the some people bodies are built. But you can still identify your azygous lobe. You can identify your azygous vein in the chest X-ray. Now we focus on the bottom images. Now this is the X-ray film of a new patient, and we can see the azygous lobe again, and we can say that this is the normal variation as we discussed earlier. This time they are pointing out the azygous vein, which is a big blood vessels in the chest. It's running through the azygous fissure, which is that split in the lungs caused by azygous vein being a bit off center. So when they say azygous vein is seen as a thick structure within the azygous fissure, they are just pointing out where that vein is in relation to the split lungs. It's nothing to worry about. It's just the part of the patient's chest look like in an X-ray. So in this X-ray, you can see this is the part here, and this is the part here they are pointing out, and this is your azygous vein, sorry, azygous fissure and azygous lobe, which is cutting through your right lung. There is another X-ray film here. Let's look at the upper structure. Sometimes in an X-ray, doctors see what looks like an extra joint at the front of the first rib, where the bones connects to the cartilage part, and that's the softer, bendy bit. They are pointing it out with an arrow. You can see in the yellow here. This might seem like a problem because it looks unusual, and but it's not actually a problem. It's just a normal variation that some people might have. The reason doctor mentions it is that it can look a bit of like a mass in the lungs, which could be concerning if they didn't realize it's just an extra joint. But once they recognize what it is, they know that there is nothing to worry about. It's just a variation in different people. Now, there is a term called pectus pectus excavatum. This is you can say that this can be defined as a congenital deformity of the ribs in the sternum, producing a concave appearance of the anterior chest wall, which means that the chest wall will look like it's caved inward in some people. In some people with a condition called pectus excavatum, their chest looks like it's caved inward. Because of this, on an X-ray, the border of the right side of the heart might not look very clear. So here you can see that border of the right side of the heart is not very clear, and you can see that the chest is concaved inward. Now, this can trick doctors. This can trick doctors because it makes a shadow that looks like there's something wrong with the right middle lobe of the lung, like a part of it isn't working properly. To be sure what's going on, doctors might take a side view X-ray. This helps them see if the problem is really with the lungs or if it's just because of the way the chest is shaped. Pectus excavatum again is something some people are born with, and while it might look a bit odd on an X-ray, it's really a big problem it's not a big problem of their health. And pectus excavatum means the chest is concaved inward. This image shows the lateral view of the lungs. Lateral mean that's the side view, right? When doctors take a side view X-ray, this is called your lateral view of the chest. On the diagram, you can see border of left atrium, border of left ventricle, inferior vena cava, and then lungs becomes more radiolucent. With the lateral view of the thorax, right, of the chest, right, they can see the shape of the heart and where the big veins like IVC enters it, and this helps them check if the heart looks normal. Normally there is a air behind the breastbone sternum and it looks dark on the X-ray. If there is any brightness or radiopacity in this space, especially at the top near the heart, it might mean there is something wrong in the front part of the chest or the upper part of the lungs. As they look down the spine on the X-ray, the bones should get darker towards the bottom. That's because there's usually less tissue there, and if it gets bigger, it might mean there's a problem in the lower part of the lung, so they need to check carefully of any issues there. So here you can see that as it is going downwards, it's getting darker. There is air behind the breastbone sternum and it look quite dark on the X-ray. Then we said that they can see shape of the heart and where the big veins enters in the heart. Your eye we see, and then they can see the borders of left ventricle and borders of the left atrium. In this X-ray, we are focusing on diaphragm. When doctors look at a chest X-ray, they check for the shape of diaphragm, which is the muscles that help you breathe. They should see the outline of both right and left diaphragm. The right diaphragm should be visible all the way to the front of the chest. They can see where the lungs meet the organ in the abdomen. The left diaphragm can only be seen until it reaches the heart. So the right diaphragm is indicated in red and the left diagram is indicated in the blue. After that, they can't see it because the heart looks the same as the organs below the diaphragm on the X-ray. So we say that on the diaphragm, on the chest X-ray, the contours of left and right diaphragm should be visible. The right diaphragm should be visible all the way to the anterior chest wall, indicated with red arrow. And we see the interface between the air in the lungs and the soft tissue structures in the abdomen. The left diaphragm can only be seen to a point where it borders the heart, indicated with blue arrow. At that point, the interface is lost since the heart has the same density as the structures below the diaphragm. So here in the yellow bottom, you can see the diaphragm. This is the diaphragm and this is your border of the heart. Another structures which we see when we discuss thorax or thoracic inlet is your arteries, your pulmonary arteries. So here is the chest X-ray indicating your pulmonary arteries, your left pulmonary artery and your right pulmonary arteries. These are the two main arteries that carry your blood to the lungs, the left and right pulmonary arteries. On the diagram in purple, you can see here the left pulmonary artery, which goes over the left main bronchus, and then in the blue you can see your right pulmonary arteries here. The right pulmonary arteries goes in front of the right main bronchus. When doctors look at the side view of X-ray, the side view is also known as your lateral view. They can see the normal structures in the lung area. This helps them spot any problems. In this case, on the front of the view of the X-ray, there is something called your hilar enlargement. This means there is a problem around where the pulmonary vessels enters the lungs, but they are not sure if it is because of the blood vessels are swollen or if there are an enlarged lymph nodes. When they look at the side view of X-ray, they see the round shape where there shouldn't be any blood vessels. This tells them that the problem is likely enlarged lymph nodes, not just swollen blood vessels. Based on these findings, they diagnose patient with sarcoidosis, a condition where the immune system causes inflammation in different parts of the body, including your lungs. They also notice that the line near the trachea, your paratracheal line, is wider than normal, which is another sign of enlarged lymph nodes. By looking at both the front and the side view X-ray, doctors can accurately diagnose conditions like sarcoidosis by identifying abnormalities in lungs and surrounding structures. Here is the clear diagram which indicates your hilar enlargement. You can see clearly here your hilar enlargement in the posterior anterior view, but it is not clear why it is dilated. Is it because of the dilated vessels or because of the enlarged lymph node? Once the lateral view, on the lateral view, there are round structures in the area where you don't expect any vessels. So you can see this part here where you don't expect any vessels. There is a round structures. in the black, and we can conclude that they are dealing with your enlarged lymph nodes, and we can say that patient has your the disease called sarcoidosis. Also notice the widening of paratracheal line. This is due to the enlarged lymph nodes. Now this is the lateral view of the lungs. When the doctors look at the side view of X-ray, the lateral view of the chest, they sometimes see some things that look like a mass in the lung. So this is pointed with yellow arrow. They think that there is a mass in the lungs, but before jumping to the conclusion, they need to check if there is any unusual density around the bones of the spine, your vertebral bodies. This can happen if someone has a condition called spondylosis, which affects the bone and the disc of spine. If they see anything unusual in the spine area on the side of the X-ray, they will also take a front view X-ray to get a better look. So they will take the posterior anterior view. They are specifically looking for a signs of spondylosis, which often show up more clearly on the front view of the X-ray. Then, when looking for the spondylosis, we have to pay attention to the right side because spondylosis is often found there. On the left side, it is less common because of the pulsation of aorta, the big artery in the chest that can make it harder for the bony growths to form. Bony growths are your osteophytes. So, there is a less likely occurrence of spondylosis found in the left side. Now notice that the upper part of the mediastinum is widened here. This part here looks more wider than normal. On the front view X-ray, doctors noticed that the upper part of the chest called your superior mediastinum looked wider than the normal. To get more information, they looked at the side view of the X-ray. They saw a density in the upper area behind the breastbone, your retrosternal space. You can see here. With these findings, they narrowed down to the possible cause to a mass in front part of the chest, your anterior mediastinum. There are four main type of masses that can be found in that area. They are often called as 4Ts in the medical shorthand. Your thymomas, teratomas, thyroid neoplasm, and T-cell lymphomas. In this case, it turned out to be a Hodgkin's lymphoma, which is a type of cancer that affects the lymphatic system. Sometimes on X-ray of adults, doctors spot something called your Bokdalk hernia. It happens because of a problem with diaphragm, the muscles that helps with breathing. The arrows point to where it is on the X-ray. You can see the blue arrows. Usually these hernias don't cause any problem and just have some fat from the abdomen, but sometimes organ from the abdomen can move up into the chest through this hole. In babies, especially newborns, these hernia can be bigger and cause more serious problems like lungs not developing properly. Another type of hernia called your Morgagni hernia is also a problem with a diaphragm, but it is not as common and it is found at the front of the chest, unlike the Bokdalk hernia, which is at the back of the chest. You can see here in the blue the hernia on the X-ray.